as the pandemic progresses, every single day becomes the day when India records the highest single day spike in the number of cases. So, for example, on Sunday, which was May 31st, India recorded 8,380 cases and became the seventh worst hit nation in the world, moving from 10th place just a week ago. So, in the week ending on May 31st, we recorded 49,000 new cases. So, it's like close to 50,000 cases in just 1 week. Okay, so all that is bad news, but what the good news is the number of active cases, which is the people who are currently sick with coronavirus disease, is almost the same as the ones who are recovered. And we've had more than 5,000 deaths, and these again are steadily climbing. Now, if you compare India, which has a huge population, and if you compare it to other countries with large populations, you find that we've actually done very well. And the lockdowns, although they were like devastating for several families, but they did prevent cases, and more importantly, it did prevent a lot of deaths over the last 2 months. So if you look at the United States, which is the worst hit country in the world, they've had more than 18 lakh cases. They are inching close to 20 lakh. Brazil has 5 lakh cases, Russia has 2 lakhs, and India is still at less than 2 lakh cases because we actually focused on keeping people indoors, which reduced transmission and which reduced the pace at which the disease was progressing in the country. So if you remember, a lot of people were talking about flattening the curve. So India has successfully done that. So what comes next? What's important is that we need to remember that the pandemic is still to peak in India. So what most modeling studies are showing is that it's going to peak in July, late July or August. But already there's lockdown fatigue. People are just fed up of being home. And now a lot of them are stepping out. They're thinking that, oh, the infections are still rising. And they don't really care about other people getting infected or they themselves getting infected, because everyone tells themselves, well, look, life has to go on. But you have to remember, we all have to remember that people are still dying, and there's still people out there who are infected, and a lot of them are undiagnosed, so they could be spreading disease, could be spreading infection without knowing it. And now as the lockdown has lifted and there's more mobility, the number of cases are bound to increase, and given our population base, the numbers in India will become very high over the next couple of weeks. So that's really nothing to panic about, it's nothing to worry about, because our focus should be on saving lives. Because as we know, this disease causes very mild disease in most people, and India is lucky. We have a young demographic, we have a very young population. The people over 65 are less than 10%, unlike in other countries where they're up to 30%. So we have to ensure that hospitals are not overrun and the deaths remain low, and people who need medical attention actually get it. And there are states in India who've successfully done that. For example, Tamil Nadu, which has the third highest number of cases in the country, has a mortality rate, has a death rate of less than 1%. And that's because they've very, very successfully expanded their testing programs. They have amongst the highest testing rates in India, and they are diagnosing disease. People who are diagnosed stay home and isolate themselves, so that prevents the disease from spreading, and they actively also hospitalize people who need care. So that's really the way ahead for our country, because we need to ensure that the number of people who die of this disease stays low over the next couple of months. So really for us, what is the way ahead? How can deaths be kept low? Well, the answers are fairly simple if you can stick to it. One is that people with mild symptoms, with even a little fever, cough, should immediately isolate themselves at home. Even if they haven't been tested, they should either stay at home. If they're tested, they should either again stay at home or in COVID care facilities. And we must absolutely hospitalize everyone with fever and difficulty breathing, especially those who have at least 2 comorbid conditions. Now, comorbid conditions are pre-existing diseases like diabetes, hypertension, kidney disease, and lung diseases like COPD and asthma, because these are people who are at risk of severe disease and death. So they should be hospitalized and should be looked after by trained health workers. Now, at the public level, we need to enforce masks and social distancing. So when we step out, we must remember the infection is still out there, and we have to protect ourselves, because only if we protect ourselves can we protect people around us. then at the government level, testing must be scaled up, and we actually should have community surveillance now. Along with that, we also need to ensure that the stigma around the disease has to be removed, because now we still see people, I mean, despite very proactive stand by governments and societies, we still have people who discriminate against people who work in hospitals, healthcare workers, frontline workers, who are putting their own lives at risk, who are risking infection every day in the line of duty, but their neighbors don't talk to them, avoid them. So we must ensure that stigma should be removed and people should be allowed to do what they have to do to protect themselves and others from the infection. So we can't really tell how widespread the infection is until we do community surveillance, which becomes very important, because if testing is low, then we don't know how widespread the disease is. So that's one area we should focus on, because really the response to the pandemic depends on the number of cases that are around, which is why we have the different zones, and it varies not between metros and cities and between cities and rural areas. So until we really understand the extent of the pandemic, we cannot mount a very powerful response against it. But at a personal level, at our level, we have to continue wearing masks, washing our hands, and looking after ourselves, because even as life returns to normal, in some ways, social isolation, hand washing, and masks is the new normal. So that's something we have to stick to if we want to stay safe.